right. Hello there, Bradley Hannon.
What's going on, Lori? How we doing? We're gonna make
Great.
it make sense.
Welcome to Make It Make Sense. So thank you for joining me to try to make this world make sense because it almost never does. This is like there are endless topics to cover here, but thanks for joining me. And so share with us, tell us a little bit about who you are, what you do. There are a lot of things. It's a short show, so I know you do a lot of things. You'll have to kind of cut it down a little.
Yeah, I don't know. I don't know whether it's because I'm getting older or I've been humbled by running into enough brick walls and realizing that I'm not invincible. But I'm just a guy that stumbled into insurance at a young age and did pretty well with it. Through kind of doing well with insurance, it blew the top off any limiting beliefs that I had. And so now I'm just pursuing all that I can be, if you will, through insurance. So I run a Medicare call center as well as a couple of independent distributions in the health and life insurance space. So having a whole lot of fun doing it. But you're an all-star too. And by the way, when it comes to a podcast, having an unlimited number of topics that you can speak of is a really, really great thing. So make it make sense. Make it make sense may be the only part of the podcast that actually makes sense.
Yeah. Yeah, you're right because you also have a podcast. So Sarasota Speaks with an X, which I love when we can employ an X instead of a K. So I support that. And you're a father of two and a dad and a husband and I don't think you sleep, but so to
Thank you
that.
for highlighting the important parts because I just skip right over that, right? I was kind of like we're in a podcast setting, so it's like, we're talking business,
Yeah.
but yes, I'm a husband, I'm a father of two beautiful boys, and now I'm a baseball coach, which
Oh my.
isn't what you think it is, right? I signed up
Not
for
at this
something.
age.
Well, no, I mean, at 5 years old, you would think that I just started another business because it requires a whole heck of a lot of meetings and things like that. So now I'm a baseball coach too.
So is it the type of baseball where everybody gets a trophy or is it competitive?
It's competitive. I wouldn't put my kids in anything but we did T-ball last year, so he's doing coach pitch this year. And so basically coach pitch is like your first 2 or 3 games. They're not keeping score. They're not there's no outs. They're kind of like scrimmage games. But after that, we keep score. We have 3 outs. The ages
Game
are
on.
5 to 7, and there's even playoffs in a championship. So um, my
Okay.
business might have to suffer for a little bit while I go after this championship,
I
but it's
imagine you'll
competitive.
just sleep less because I don't think you can half-ass much that you do. So,
Thank you.
well, to that end, as busy as you are, I really appreciate you taking the time out and talking about everyone's favorite topic with me, which is healthcare in America. It's not everyone's favorite topic, but it's so necessary, right? Like, I don't know about you, but I feel like I say to clients often because they're almost kind of embarrassed. They'll say, I don't know anything about insurance. And I'm like, you and everybody else, like there is not an education for this. Everybody seems to have an opinion, but really nobody really understands it
That's true.
fully. So you started in under 65 health insurance, right? And so
Correct. Yep.
transitioned. Why?
So, well, I mean, I kind of have an open mind and, I see opportunity. One of the things that I will say, my business partner, when I first started the Medicare call center that he, mentioned, he's like, man, I knew that you would be great at doing this. I just didn't know, like, I knew that this would be a great fit for you. I just didn't know if you were going to be able to see the fit that it would be for you because of how involved you are in the independent 1099 distributions and under 65 health insurance and ACA and that kind of stuff. I just didn't know if you were going to see the opportunity for what it really is. And I think I just went into it like I go into anything, whether it be a conversation, whether it be a meeting, whether it be, an introduction to somebody that, might help me put together the next big deal, or I might help them put together the next big deal. Just go into it with an open mind and a willingness to say, hey, this may work out. It may not work out, but we're certainly going to give it every opportunity to be successful. So the Medicare call center was something that, I thought that my skill set would be a good fit for, but also there's a huge need. I mean, there's a massive number of people turning 65 every day. I think everybody knows it's 10,000 plus people every day turning 65.
Wow.
You know, I started out in telesales. Actually, I started out in telesales. I stayed in telesales, and I never evolved out of telesales. Like I just does like sometimes agents will say, "Hey, do we ever run face-to-face appointments?" And it's not that I'm against it. I'm just like, well, why would you want to do that? I don't really. I mean, by the time you get that
That's
person out of
backward.
your, yeah,
Yeah.
like by the time you get that person out of your office and they're telling you, you know, and listen, this is going to come off probably poorly, but they're telling you about like their, you know, back in the day stories and whatever else, and they're dragging the meeting out. You could have called and closed 2 other deals. And not that it's all about closing deals and making money or whatever. It's for me, it's about efficiency. So our core values are energy, efficiency, excellence, and effort. We were talking about kids a whole lot. Efficiency didn't mean shit to me, you know, 5 years ago, 6 years ago, because why? Because I just slept less and I worked more hours, right? Now, even if I do work more hours, those hours are like when my kids are sleeping, which is time that I wish that I was sleeping sometimes, or it's, you know, early mornings or whatever, because I have always said I'll be home when before my kids go to sleep, and I'll be there when they wake up. And for the most part, that always holds true. I mean, I'm home every night before they go to bed to tuck them in and have dinner, even if it's 30 minutes. And I'm there every morning to wake them up and get them dressed for school. And you know, I think I'm not like patting myself on the back, because that's not like, you know, setting the bar very high. But for the current phase of life we're in, that's my goal, is to be present with them, you know, every moment that I can. So why Medicare? Why the call center? I guess the simplest answer is because it was a great opportunity that opened itself up. And you know, I went into it with an open mind, and I'm certainly grateful that I did.
So which one's your favorite then?
I can't I can't really I think insurance is insurance. I don't necessarily have a favorite, like as far as the vertical, like the vertical that it is, but I definitely love the employee based model. There's good and bad. I mean, it's a whole lot more like headache and, you know, hoops you got to jump through and stuff for certain things, but it's also super rewarding because, you know, those things that your independent contractor 1099 agent is not doing, that you just wish that they would do, or, you know, whatever, to make them successful with a W-2 employee. Like, it's not that I dictate things and like, hey, you're my employee, you have to do this. It's just like the expectation is different when you go into a job and they tell you, hey, do X, Y, and Z. Like, you typically do those things not because they're going to make you successful, but because they're going to make you not get fired, right?
Sure.
Like, you're
'Cause
going to
you
keep your
want to,
job.
yeah.
You're going to
Yeah.
keep your job if you do what your boss tells you to do, or your sales manager or whatever else. And so they do those things. Maybe they do them to be successful. Maybe they do them, you know, because they're told to do them, and there's, you know, they're just kind of checking the boxes. But inevitably, it leads them to success, and the turnover is a lot lower. And you know, I just have been able to eliminate a lot of barriers for agents, you know, getting started. I mean, I had an agent make $147,000 last year, or something, 140 something thousand dollars net take home pay. And you know, it's still very rewarding, right? Like, I mean, this person came in not ever selling Medicare to, you know, getting on the phone, and they have inbound calls and, you know, a structure. And you know, a lot of people need structure. They just don't like it. And so they don't ever apply structure in their own life, and discipline and all of these things that you know, kind of go to the wayside when you're working for yourself, right?
Well,
If you're
I
not
would say that
successful.
discipline is like your middle name though. In my phone, I'm going to tell you, I don't know if you remember this, but your contact was forwarded to me from Dakota, and
Mhm.
you are still in my phone as Brad, the healthcare hustler. So like, all that to say, you just know a thing or two about health insurance, which is why I thought you were the perfect guest to talk about it. Just like, so that's like the nitty gritty of what we do, but like healthcare in America, I think
Yeah,
I say at least 100 times a week, healthcare is broken in our country.
absolutely.
Right. So, I mean, you believe that, right? Like we get to see
I do.
all sides
Yeah.
of it.
Yeah,
So,
I absolutely do. And I'm glad that we're clarifying here, because I'm like, are we talking healthcare? I didn't know how deep you wanted me to go to insurance, because you know how I talk about insurance. Insurance sucks. I just make it suck a little bit less.
yeah.
Or are we talking about healthcare? Because you and I both know when we're talking to clients, they're like, "Well, I don't have healthcare." Well, no, you have healthcare. I mean, there's a doctor around the street or around the corner from your house. There's a hospital in your city, I'm sure. So you have healthcare. What you mean to say is you don't have health insurance, right? And those are
Right.
two different things. So health insurance, I think, is a little bit broken as well. But healthcare is absolutely broken. And what's funny about the conversation we're having about healthcare, I joked with you. I said, I don't know what I'm going to talk about. I don't know anything about healthcare. I truly, there's a lot to know there, right? So in when you're talking relative to how much some people know about healthcare, I'm not an expert, right? And I'm willing to admit that. But through the Medicare call center and through some relationships and through some, just kind of recent happenings, I've been learning an awful lot about healthcare. And it's good because I think that, to really understand the entire system that your client is dealing with, you certainly have to learn a little bit about the healthcare side, and not just what your sales leader told you to make more sales about how it's supposed to work, or what what you learned from whatever company that you're affiliated with about healthcare, but like from the actual healthcare providers, like how much of the information that you and I have heard through sales leaders and organizations and such is kind of regurgitated from sales manager, sales manager, sales leader, sales leader, that's not directly coming from the source like a healthcare provider. So I've been spending a lot more time with healthcare providers. Ex-CEO of a hospital here local is more than likely coming on board with the Medicare call center, kind of the business development realm. She's introduced me to a bunch of providers and doctors' offices, and I'm like learning their language and their lingo and what they have to deal with. And it definitely is applicable to what we do every single day. So I'm sure that the audience that's listening to this can pick up a few nuggets here and there from both of us. But it is important to indicate, like you said, we're dealing with a broken system. So there's imperfection in the system that we're dealing with. And some things are, kind of have to deal with, for lack of a better.
So healthcare in general, do you think it's a privilege or a right?
Good question. I mean, I definitely think it's a right, right? Basic healthcare is absolutely a right.
I wonder if your answer would have been different before you moved into like the social insurance Medicare side of things, because it wouldn't. You think everybody should have access?
Yeah. No, it's a basic human right. Like, I mean, freedom of speech is a basic human right, but that doesn't mean I'm not going to get slapped with a bunch of lawsuits if I exercise that right to the fullest extent that I possibly can. Now, the difference is if I'm exercising that right, but I'm a billionaire, and then I get slapped with a bunch of lawsuits, I got freaking defense attorneys, like out the wazoo here to help me out. So there's a difference between the basic human right and then, the exercising that fully. I mean, healthcare for sure is a right, right? I mean, it should be a right for the basic emergency, that type of stuff. But there's also
whose dollar?
Well, I mean, we're not talking about the financial aspect of it, right? Like I believe it's a human right, right? We should all have the right to good healthcare. I'm not saying it should always be free. I'm not saying it should, how do we fund it? That's a whole different conversation. But then I think, when you look at the, what was the other term you used? Was it a right or is it a
privilege?
A privilege. The privilege side of it is obviously, the better the insurance plan you have, the more people I mean, it's just like anything in life, the better connected you are, the better healthcare you're going to get. Do I agree with that? No.
Or the better funded you are, because I think that the wealthy definitely skip the queue. They move ahead. Sure. They have better access. But 57% of Americans believe that the government should provide healthcare to all citizens. 40% do not, which I somewhat
feel like my answer reflected that data. Like I kind of was on both sides of the fence, and that's funny because
so I think I would expect it to be a higher percentage don't. And maybe it's just because I live in Texas, because it's definitely a political issue, right? Where people are very one side or the other. And I get to hear a lot of people who don't think that the government should have any hand in it. But 53% of Americans think that healthcare should be private, not government run. And I think I am one of the 53%. I think
I
all the
think
a
I
marriage
think
of
I
the two.
am too.
Yeah.
I think I am too. And I'm gonna kind of change my answer and back up a little bit because I feel like you asked a question with very little context on purpose. It was almost like a trick question, but not really.
Maybe a
And
what?
like, is it a right to healthcare? Absolutely. Like, I mean, every human, regardless of their own financial, situation, should have a right to be revived if they're dying or to like go to the emergency room if their limb is chopped off. Like, I mean, yes, there's a aspect of it that should fall under your basic human rights. Beyond that, beyond keeping you alive, beyond, stabilizing you, beyond all of that stuff. I mean, I don't, I'm, that's tough to say, but I do believe it should
Hard.
be privatized and it should, I mean, there are things and programs in place, but it's no, I mean, I had a veteran organization on the podcast the other day. They deal with veteran affairs and help get veterans retroactive dollars for if disabilities and things like that they qualified for, but they got stuck in the bureaucracy of it. And if it's happening to veterans, that, I mean, one example was like the guy lost his whole finger, and there's like a percentage scale. Like if you lose like this knuckle and this knuckle, you get like 30% disability benefit or whatever. If you lose the whole finger, it's 50%. I'm just making these up, but clearly he had lost his whole finger, and he was only getting the 30%. So he went and saw this guy we had on the podcast who's an attorney who kind of fights these cases for them. And he's like, clearly it was, completely off. And when I talked to the VA, they're like, well, how do we know it wasn't taken off completely after the fact? And he's like, well, because the medical records from the original surgery show that this knuckle, and this knuckle were removed. Like, here's the medical terms for these knuckles. Here's the chart that shows they were removed. Clearly it was removed. They go, okay, and they stamped it, approved. Here's your 50% disability. Now, if it happens in some sort of like obvious, simple scenario like that, of course it's going to happen in your everyday, healthcare situations as well. Like the bureaucracy of it is the difficult part. So privatizing it, I'm just giving you a long answer, but I think privatizing it keeps it from becoming a big bureaucracy.
So I mean, I think that I would say my belief is it's kind of a marriage of the two, right? Like, so the marketplace and the exchange is definitely the government's hand in insurance, and then
For
you've
sure.
got the private side of things that it gives people an alternative to the marketplace, and to me, that's probably how it should be. That's kind of always how it has been. We're kind of at a place where it's being threatened now, right? Like they want to essentially do away with the private side of things and they want to push everyone to the marketplace. I think we just because we're America and we're all about choices and freedoms, we
Mhm.
should have a choice in it. So, I don't necessarily want the government to be the only one that gets to decide what we can have as our healthcare. And I think that that's where it gets a little bit dangerous because it's hard to give a blanket solution for everyone, right?
And that ain't even the Texas in you saying that either. That's just the American in you. I
That's
mean,
the
I
American
think.
in me because I'm a Missourian, like by trade. So
Oh, there you
like,
go.
yeah, so like it's not, it's just like seeing it. And right now, I mean, my personal journey, like I am on a marketplace plan and it's been super helpful in my situation and all of the treatment that I'm having. And I do think that there's more stuff that we'll talk about, like how they price things out is so
Oh,
absurd.
huge.
I mean, just in from September to December of last year, there was probably $50,000+ worth of claims charged to my insurance for treatment that I had over the end of the year. Like that's kind of insane, right?
Right.
And so I am one who I don't think that the marketplace should go away. There's absolutely a purpose for it. I'm appreciative of it. And I think what's interesting to me is that, 53% of Americans say that the government shouldn't have their hand in it. Yet 37% of Americans have Medicare or Medicaid, exceeding $728 billion in expense in 2021 was the statistic. So I think it's I say all of that to say, I think it's one of those things that people have a hard opinion about until they need it. And then it's
Mhm.
like a whole other story, right? Once you start to see how those programs help people, you feel a little bit differently about them.
Yeah, or until, either that or until they're, educated on the topic. I mean, if you and I weren't in insurance, I mean, we wouldn't be too concerned with healthcare unless we were going through something,
In
unless
the
we
need of
were
it. Yeah.
in the middle of the hospital, right? Like,
Sure.
like there has to be a situation where this comes, you come face to face with it, and then you're like, oh, okay, I see the issue. One example I can think of would just be something as simple as, you know, like having a procedure done and but with no insurance. Like, I think the people that don't have insurance get the best glimpse at what our healthcare system could be if it was a little bit more privatized, with like transparency and pricing and things like that. And of course, we're trying to do more on that. On that one issue alone, is just having more transparent and fixed prices. However, like if you're a cash payer, right, going to a provider of any sort, you have some wiggle room, you have some negotiation, and they will tell you, you got a price sometimes, but they will give you a price prior to you having a procedure done, right? Like, I got to get a colonoscopy. Let's say I don't have to get a colonoscopy, thankfully.
But you
Um,
should. What a good time. Just kidding.
but oh God, I'm
I've
like,
never had one. I have no idea.
I need some more. I think I'm too young for one of those things so far. So that's a good problem to have. But the colonoscopy, for instance, right? That's the first one that came to mind. My sales manager just recently was hospitalized and had some, he's all good, and thankfully he's a specimen of health. He just had this weird little scare, but they had to do a colonoscopy. So that's right on top of my mind. And if I was to have one done and I called this provider and said, hey, I'm a cash payer, it is what it is. They can give me a price on the colonoscopy. Now they can't give me a price on it. What if they find something and they have to do, further procedure or whatever, but like they can give me a price on it. If I call another provider, they're going to give me a different price, I'm sure. Now the difference comes into play when you have insurance, right? And let's say you're on a plan that doesn't have a copay for that procedure, right? It's going to be billed to your insurance. So like the provider is going to say, when you ask them, hey, what is it going to cost me to have a colonoscopy done, right? They're going to say, well, do you have insurance or not? If you say no, more than likely you can get a price out of them, right? Again, you may have to pry. It's tough. But if you say you have insurance, it's like, oh, well, we have no idea. We don't know. We would have to bill your insurance, and then we would come back to you and let you know what you owed us. It's like, that doesn't make sense, right? But why is that? Why are they doing that? Like, why does that happen? Do you know?
Because they get more money if they involve insurance.
Right,
100%.
because they're going to bill the insurance for as much as they possibly can get through the insurance
100%.
company, and then they're going to balance bill the client for the remainder, right? Or if the insurance doesn't pay enough, or the copay, or what have you, and so they're not going to, um, they're not going to shortchange themselves on the amount that they can get. Now, the other issue is like, are they not worth that? I mean, is it not? Is that not like fair? I mean, these people are healthcare providers. Should they be making a ton of money? Absolutely. Like they're keeping America healthy. Hopefully that's the goal, right? Not just kind of troubleshooting ailments, but keeping us healthy and away from those ailments. But it shouldn't be at the expense of, the consumer, right? So I don't know. I'm torn on the whole thing, but I know as like a cash payer in a lot of circumstances, for me personally, kind of catastrophic coverage in place for the what ifs. And then, when I go to the doctor, hell no, I don't have insurance. I got no insurance. I need the lowest cash price I can negotiate. So
Sure, but the part of that is like we are in this industry, so we know the tricks. But the sad thing is like the average person doesn't know all of this, and they don't want to spend the time or the inconvenience of doing it some of these ways. And it's really kind of dirty by the providers, because oftentimes, to your point, when you say there's insurance involved at all, they won't even consider not billing it through your
right,
insurance. It's no longer an option. We know you have insurance, therefore we're going to bill it. And it's because they can, ratchet the price up a ton. And that is, to me, if someone asked me what was the most broken part of our healthcare system, that's it right there. It's that there's not any standard for what things can cost, and anybody can charge whatever they want. And
don't you think we should just have like, online shopping for it, like Amazon, like just go on Amazon and order up a colonoscopy?
I
Just
mean, maybe not to that because I order way too much stuff off of Amazon for that example. But I mean, I
you're
do
not going
think
to load your cart full of colonoscopies. It's
not,
fine.
I've never had one. Like I said, I mean, it might be good to get all cleaned out, but like it's just to me that is the most broken part of it is that there's not any say in if the government wants to be involved, to me, that's where they should be involved, right? Is in mandating what can be charged and just period. There's a price. Every oncologist for this treatment, it's this cost. And and for providers, so much of what they make is tied into the medications that they prescribe. Like they make, I don't know how true the statistic is. It was something that in my journey, someone said to me along the way is that providers make 73% of their income off of the medication that they prescribe, which is terrifying. I
That is
mean,
crazy.
that's wild, right? And it explains why you go to a doctor and they start you on a Vyvanse before it had a generic option, right?
Right.
Versus giving you an Adderall that you can get for like $10 or whatever. But if that's dictating the care that we get, that's also a little bit scary, right?
I have to look that statistic up because that's just
Sounds wild. I know I have not
that's just
verified it.
crazy.
Someone said it to me, but it also didn't shock me, like knock me out of my chair. Like there's no way that that's true because it sure feels
I
true.
mean, it just the quick Google search just says that it's illegal for them to receive financial benefit in reward for prescribing, but that doesn't mean there's not a loophole, right? That
Do
doesn't
you
mean there's
not
not
think
a
that
way
they
around it.
do? Do you not
Of
feel
course,
in your life like that statistic feels true? Not that it is. I have no
it
idea. Like I did
feels
not
true.
verify.
It
It
feels
feels
true for sure. I just avoid doctors. I mean, and even when I talk to clients, I'm like, they're like, "Oh no, I'm you have any doctors that you see regularly or anything like that?" And people will often say like, "No, no, I'm pretty healthy. I rarely go." I said, "Yeah, you're not not going because you're healthy. You're healthy because you're not going." Like,
right.
you know
Because
what
you
I
have
mean?
no
Like,
idea. You don't
right.
know.
Well, yeah, I mean, that's just turning a blind eye, but like,
You don't know.
when you don't feel good, right? Like, when you're not completely a specimen of health. But I think avoiding doctors, obviously we got to get tests and scans and things like that when it's age appropriate. We've got to stay on top of, women's health and things like that. But there are certain things like, there's a certain limitation to it as far as get your blood work done, get your basics done, and then stay the heck away from doctors if you're healthy for the most part is how I feel.
Except that, that brings up a point. Like even the age appropriateness of these, preventative things that we're asked to do are kind of really falling by the wayside as time goes on. Like
That's true.
obviously I've done a ton of research myself on cancer just because of my current situation. And that people are getting younger and younger. Like the people that are diagnosed with cancers under the age of 40 has increased, exponentially in the past decade because of all these environmental factors, is my guess. But so it's almost like you can't really put an age on this stuff anymore.
It's because of red 40 and because of like all the crap in the foods we eat, right?
100%. Well, I mean, every like all of our, if you animal protein, it's all injected with hormones, which hormones are cancer feeds off of hormones. If you eat vegetables, it's twice as expensive to buy organic and to know that it wasn't touched by a pesticide. But even if there's a pesticide that ever affected the soil, it's just like
I've
every
also heard that organic just means that they have less than 8 pesticides used or something like that. There was a number, it was like 5 or 6 or 7, but like they still use it. I don't know. I mean, listen, at the end of the day, I'm not like, it's kind of depressing to get really into that stuff. You know what I mean? Like the more I look into it, the more I'm like,
who are you telling?
shoot,
Yeah,
like
wild.
it's like, dang. And so you kind of, just like, I don't know, you do what you can, right? But I have to just say this real quick because if you're like, if someone's listening to this or watching this or hearing this or whatever, and they're like, these two people don't know what the hell they're talking about with healthcare. It's like, yeah, you're right. We don't. But the scary thing is we know like probably 70-80% more than like your average
The average
person,
person.
and we're still uneducated about it. You know what I mean? Like that, it would be a full-time job for me to, study this healthcare system and, transparency and pricing and, Medicare and Medicaid fraud, waste and abuse. And of course we go through classes and trainings and things like that, but like to really, really understand it at a, national level. I mean, it's a freaking mess for
I
sure.
don't know that anyone would know. It's interesting to me. Clients will say, like, I'm going to ask my doctor, my provider about this billing. And I'm like, that is the worst. That's like you asking me how to like surgically remove your gallbladder. Like they
Yeah,
don't have any idea.
right.
And they don't have anything to do with the billing part of it, but people just, it's also muddy.
But
And
they
they're
definitely know what insurance carriers they're billing the most and making the most money from. Trust me, it's on a spreadsheet somewhere in their back end of things. So if you're asking your provider for the best insurance plan or advice on insurance or any of that stuff, they're going to give you the name of the insurance carrier that pays the most claims to their practice, right? It would be like, who's your best customer? And like, I mean, if you run a retail store, a bar, right, you got like a regular that's coming in there all the time. Like, who's your best customer? Like, who that person is. This
Bob.
guy spent 10 grand at the bar last year,
That
buying
doesn't mean
shots and drinks.
it doesn't mean it's the best carrier. And
Correct.
the sad thing about health insurance in our country is that people think premium equates to paying nothing when you go to the doctor. And that's not even reasonable. Like, you're always going to have out of pocket. And that's how people judge their plan, is how much should I come out of pocket? That doesn't necessarily mean it's the best plan, but I digress.
No doubt.
So I do think, as far as your other world, the Medicare world, I think it is interesting to know that Medicare is that less than 1% of people over the age of 65 have Medicare, because of the way that that program is structured compared to the Marketplace, the under 65 government run program. So they've done something right there, but at
Say
what
that again. Say that again, because I think you said it backwards or I heard it backwards. Less
less
than
than
1%.
1% don't have coverage because that are
Oh,
over.
okay. Right. Okay. I
So
thought you were saying less than 1% have it. I'm like,
no, 99% have.
I'm pretty sure we insure 1% of the population by now.
Right. So 99% of participants over the age of 65 have Medicare, because something right has happened with that program. But at what cost? Because I mean, we had the other statistic that was $728 billion between Medicare and Medicaid. So
Yeah, you can look at it from that perspective and say something right is going on, or you can look at it from the perspective of, it's only going to be going right through 2027, and then we don't know how we're funding the program anymore. Like our government has no clue how they're going to continue funding the Medicare program, Medicare Advantage more specifically, after 2027. Like the funding that we had projected and budgeted for, it like runs out 2027. And so there's going to be some, changes or whatnot. But what you're referring to is original Medicare, because original Medicare is Part A, Part B, right? So you turn 65, you enroll in, and I think they tried to do something similar with ACA with, penalizing people for not having it. If you turn 65 and don't properly delay your Part B, like if you're working and you're 66, 67, which is becoming more and more common, and you have like an employer sponsored health plan, you can delay your Part B premium. So you haven't necessarily signed up, you're over 65, but you haven't signed up for your Part B yet because it would cost you money and you're not going to use it. So you delay it, right? Once you retire, you can now opt into Part B. So you're paying a premium for Part B. I think it's like $176 this year. It's bad. I run a Medicare call center. I don't know, but I'm just not like in the
You're
sales
not
every day.
on the floor.
I think it's $176, but the point that I'm trying to make is that they have a system. I mean, and also like when you're turning when you're 63, 64, like you're starting to get educated about it. I mean, I give the government the benefit of the doubt a little bit on the fact that they rolled this out. It required a whole lot of education. I mean, I don't know if you ever did the background into it, but like, when they rolled out the ACA, they had there was something as crazy as a program for barbers and hairstylists that would get they would basically be like certified to be a navigator in the healthcare exchange, and because they have people in their chair that they can talk to every day about it. So they like grassroots, tried to like
Oh,
do that. And now this could work over some time, and it could be fixed, and or fixed up a little bit at least. I don't think it's a perfect solution, but one way or the other, the point we're talking about is the government meddling in healthcare, and it caused a whole lot of confusion. And it takes time to clear up that confusion. With Medicare, I think it's been in existence for so long that now people are used to when they turn 65, they know they go on Medicare, but we rolled this Obamacare ACA out, just bam, like it's here, and with very little actual education and such. So that's
well, it's been
kind
a
of the
decade now. I mean, this is the 10th year, right?
what's
So,
that? Oh yeah.
for the ACA.
Right.
So it's not new. It seems like it's here to people, I love it. People call it Obamacare, people call it Biden care, whatever. It's still here, and I don't foresee it going away. It seems like they're trying to strengthen it at this point. So, question, do you think that undocumented
Oh my
citizens or
goodness.
undocumented aliens, whatever the correct term is, do you think that they should have health care and that Uncle Sam should pay for such healthcare, said healthcare?
Uh, no, I mean, the obvious answer would be no. I think they're human beings, and I think it goes back to, the human right would be, stabilize, like, get them to not die,
And then shove
stable,
them out the
and
door.
then get them back to their country, right? Like,
Okay.
I mean, I just it like it may sound harsh. I don't know, the full extent of that and how that shakes out, but I mean, it just seems like it would be the practical answer. Like,
Well,
you know,
it's expensive. I can tell you. Texas pays
yeah,
between
probably the highest.
62 and $90 million to help to pay for illegal aliens on Medicaid,
Yeah, that's
which
crazy.
is a lot of money, right? I mean,
How
you
how
do have
can you get on how can you get on Medicaid as a illegal alien? Because that means you're not a citizen. So how you're on Medicaid?
well,
I mean,
so
that's the
you
whole thing
can't
that's mind blowing.
there are definitely so you can't get on the marketplace, which you would automatically get kicked to Medicaid, and there are different requirements for Medicaid. It's just a looser criteria than the marketplace, which is
It's crazy.
also really interesting, right? And I don't know how I feel about this one. I do think that we have a responsibility to every other person to help where we can. But I, definitely feel the higher tax part of it, or, my premium on an exchange plan that I pay full price for because of income is, $500+ a month,
Right.
because I'm essentially paying for the people that are not paying for it, right? So
Yeah.
that part, that stings a little bit.
Or even just your tax dollars, right? Like, I mean,
Well,
it
and
doesn't,
your tax,
who
but
cares
it's
about it's your premium, your
double
tax dollars, like anywhere you're, shipping off money to the government. Like it's like, you've given your kid money to go to school and buy school lunch, right? So like you'd be pissed if you gave your kid $3-4, like, yeah, go buy, you get yourself a pizza today. You had a great week, and then they bought like candy from the gas station or something. You're like, no, I didn't say buy candy. I said buy your lunch, like that's
right.
just an improper use of your funds. And so any money that you're giving to the government, and then that you find out like, oh, they're backdooring this 60-70 million dollars to illegal aliens in healthcare, like, could that be cut to 10 million if we're like stabilizing, doing what we need to do, getting them back to, where they came from essentially? And that's, I mean, that, like, I would feel that way about anything. Like if my kids had a friend over to our house that was playing with them and he got hurt, like we would bandage that kid up and we would take care of that kid and we would get them back to who's responsible for them, which is their parents. Right. So, and I don't know, man. Maybe if that kid's parents I knew were like bad parents, so if we're sending them back to a country that's not taking care of them, I guess that's where that's where it's a tough call to make. And I'm
Well,
fortunate that I'm not the one
it's
making it.
subjective.
Right.
So like you might think that country's bad. I might think it's fine. There are parts of this country that are bad. So it's all just so subjective at that point that I don't know what the answer is. I know that morally there's an answer, and as a taxpayer there might be another, but it's definitely tricky. And I think I feel it more here just because of where we are.
Yeah, for
Um,
sure.
I mean,
It's
because that's a
definitely
big
big
$90
Texas
million.
thing.
I could do a lot of Amazon ordering with 90 million. I could order a lot of colonoscopies with 90 million. Just saying.
Yeah, well, I mean,
Oh,
I think it comes down to we definitely have a responsibility to take care of our own first. So, you know, I guess the political answer to that question would be, you know, assuming that our own citizens are 100% taken care of and there's no, you know, brokenness in the system. You know, hey, we got a great system. It allows us to work out of an abundance and take care of people that are here illegally. Great, but that's not what we're talking about, right?
I
So
don't know that that will ever be our reality.
I, it would be very tough. That would be very difficult. I don't know that it will either, but I'm not a pessimist like you, so I'm just optimistically
I'm super
hoping.
pessimistic. Okay, so then universal healthcare, because this is the other thing that comes up all the time. People will say our government should just pay for all of it.
Mhm.
I think there are pros and cons to universal healthcare, but I'm also not moving to Canada. So like, what are your thoughts? Do you think the government should pay for all of it?
Yeah, I mean, I just think I know these questions on a very surface level. I mean, especially being in insurance, right? I talk to clients that are, you know, from Canada and they've moved here and now they're securing health insurance in the United States. And, you know, the natural question for me as an inquisitive, open-minded person is going to be, you know, so tell me, like, you're in Canada, they got kind of a private or like a, you know, a social, the kind of social medicine type vibe there, right? Like, I don't know anything about Canada's healthcare system. I just know that there's more government involvement. And then they tell me like, it's, you know, it's not great. Like if you really, I mean, like, yes, it's more affordable and whatnot, but like if you really need treatment and you need to see the doctor, like you can be on a waiting list for a year, you know, or like you talk to some anywhere there's universal health care. I think that's the biggest thing is like, well, even where there's universal health care, there's still a,
Problems.
a problems, yes, and mostly with I mean, common sense tells me if I'm a doctor and I'm going to school, I can take care of the people that are being funded by the government and have, you know, there's the margins are a much lower, or I could start a private practice. And I don't know if this is even allowed in universal healthcare systems, but I believe that there is some sort of that going on. You know, I could start a practice that services more people that have privatized healthcare or supplemental healthcare, because most of the common responses I've got to asking questions to people that have come from countries with universal healthcare is like, yeah, but most people that can afford it still have some sort of supplemental plan to, you know, kind of give them a ticket to the front of the line,
Yeah, so
which
that's the biggest con, or one of the cons that's listed always everywhere I could find, was that access to medical resources is more difficult, and that there are longer wait times for basic care because of these, just everybody can get it, and
absolutely.
that there are lots of people who don't necessarily like there's a either your hypochondriacs that go for everything because there's no cost to it. They're not weighing what's happening with them, with should they actually seek care, where I think we have the opposite problem here, right? People will say it's going to cost me so much every time I use my plan. I find myself not going sometimes when maybe I wanted to. So there's got to be like some sort of happy medium
Oh
there.
man, that's me to a T, whether I can afford it or not. I'm like, my kid's got an ear infection. I'm like, you know, and what's funny, here's another odd thing. I don't know if you pro vaccine or pro vaccinations, not vaccine, but pro or con or whatever. But like, you know, we're talking about the healthcare system, and you know, it's hard to trust the healthcare system when you have all that stuff going on or had all that stuff going on. But my kid has an ear infection, and he goes to the doctor. We go to a special doctor's office because it's like one of the only ones in town that will work with us as a patient with kids that are non-vaccinated, not COVID vaccinations, but like, you know, all the other vaccination they give you that, you know, aren't I don't know, aren't really all that necessary, I don't think. Probably get some feedback on that one, but who cares? So my wife has done the research and I trust her, but we didn't do the vaccinations with our youngest, and we did only a couple with our oldest before we were educated on it, or she was educated on it. And so long story short, we have to go to the specific doctor. It's like an urgent care, so it's $150 when we go, not through insurance. They don't accept the insurance that we're on anyways. And even if they did, I would probably pay cash. It just makes more sense. And so he gets an ear infection, send him to the doctor, he gets a prescription, comes home, takes the whole prescription. Like a week after the prescription's done, he says his ear's hurting again. And I'm like, crap, man, we got to go back to this, another $150, obviously we went, and thankfully we did, because we got a stronger prescription. It's all good. But, if I'm somebody else, or if, like that, if I'm not fortunate to be able to afford that second visit or whatever, like people are going to avoid or hold off, or, and then it causes further problems, right? Like they said, if we didn't bring him in that second time, his eardrum was swelling, and his eardrum could swell to a point where they would have to do some procedure, right? And that,
Sure.
like,
Sure.
that could very well happen with, someone who's worried about the cost of going into the provider.
And vaccines are like a great topic, honestly, because the cost that they run for vaccines is so wild. Like if you let it run through insurance, I remember for my daughter at her 4 year, because 4 years you get a lot of vaccinations. I think it's 3, but one of them is a combo. So it's like a lot they're doing to your kid.
Which sounds wonderful, right? A
Yeah,
combo vaccination. We're gonna just put a bunch of little mini viruses in your kid.
for sure. So if we had not had insurance, the cost would have been over $400. No, $900. Sorry, $400 in admin fees, over $900 for these vaccinations if we had not had insurance. And you can go to the county or your state or whatever, the health department, and get these things for like $15, right? Like they're just not expensive. I don't know if I would vaccinate, like if I had kids now. I don't know that I would make the same choices. I think I was a young parent who was like barely felt qualified to be a parent, like a lot of people
Well,
do.
it's the awareness of it now too. I mean, you look at like Joe Rogan and some I think it was like, what's his name, MF CEO guy, whatever, a couple of like, influencer type people have come out publicly and saying they got off SSRIs, right, which is like your like
Selective serotonin reuptake
yeah,
inhibitors.
exactly, there you go. But what's the name of one of those? Give me an example of the name of one of those.
Like all of your antidepressants, all of your like
Give me the name of one, because the only
Xanax,
one
um
Xanax. There you go. But there's another one that
Lexapro.
Lexapro. You
Okay,
nailed it, right? So
okay.
a lot of people take Lexapro, and what's funny is like the through the issues that we've seen in the healthcare system recently with, big pharma and things like that, like that's kind of caused them to take a closer look at the medications they're actually taking, and they've recently gotten off of them. And like that's freaking, I mean, thank God I've never been on that. But I can't and I just couldn't imagine being on something that's like, hey, this is just to level out your mood, so you're not too happy and you're not too sad, you're just like kind of
Robotic.
through life. And I'm like, that doesn't sound good to me,
I think that so I tend to believe that like a combination between Eastern and Western medicine is probably the way to go. But the issue in our country is that doctors go to school to learn medicine and to learn prescribing things, right? And I think, but I think like you break a bone, yeah, Western medicine all the way. Like, I mean, what are you going to do? You're not going to take some essential oils and rub it on your broken bone, right? Like, like it does have a place, but I think, we do overprescribe. You see that in your job as much as I see it in mine. But there are times like, where I think to me, the bigger concern is not taking a Lexapro, but taking a Lexapro for the rest of your life is scary. Like
Yeah.
not like taking it when you're in a season that requires some additional help makes sense. But it's like you wouldn't take an antibiotic forever. Like, like most medications should not be, or those types of medications that are mood stabilizers should not be
I just
unless
worry about the addictive characteristics of it. You know what I mean? Like, sure, you could say that, but it's hard to take Adderall for a year because you need to
Well,
focus and
that's
get more
so
done. Or
different. I mean, they're both mental health medications,
okay,
but
fine. Well, let's talk to Lexapro.
an
It's hard to take
amphetamine.
Lexapro for a year while you're depressed and then, not be depressed anymore and get off of it. And then like something happens and you feel it more because you're off of it. And so it's like, I feel like there's got to be like an addictive characteristic to it.
So I wonder if it's addictive or if it's that doctors don't necessarily, because my experience is that doctors don't really necessarily spend the time to talk to you. Like they're really quick to write the prescription and get you out the door. But then there's not like the follow-up visit, because like for those types of medications, you're supposed to see the doctor once a quarter. Like typically you have to go for maintenance for medication management, right?
Mhm.
And they don't necessarily, in my experience, have the conversation to say, what's changed? How are you feeling? Should we dose you down and then try to move you off of it? Like that's not necessary. It's like we check the box and it's fixed. So now we're just never going to revisit it. We're just going to continue to write the script. And that's the part that feels a little bit wrong about some of those, but I'm not a doctor. Like, I don't know. I just know for me, sure, there have been times when that might have helped, but I would never, I don't even like to take medication. So I would never want to be on it for like the long haul. Plus,
Right.
like, who the hell can remember to take like a medication every day? I'm just not that girl.
I just
Like,
don't like to be addicted to anything because I'm a control freak. And so if it's like, if it's not controlling me, or if I'm not controlling it, it's controlling me, right? When it comes to something like that, I would feel like. So, um, yeah, I don't like being addicted to anything. And, it's when I am, I'm like, okay, I gotta figure out what's going on here. So, and
fair.
because I'm a control freak, I gotta take a little control of your podcast here, if you don't mind, right? From one
Sure.
host to another host.
Okay. What you got?
How do we end this on a positive yet informative note? Like what advice should we have to those that maybe, and again, we're not like the most educated on the healthcare system either, right? Like it's not, we're not studying it day in and day out. We just kind of exist in that ecosystem and are, a couple of steps removed from healthcare, or one step really removed from healthcare. So we got to get to see a little bit more of it. But what, like, to your, everyday average person that has no involvement in healthcare, like what do we do to successfully navigate? What are some of the things that make the most sense if we're making it make sense?
I think that the answer is kind of built into the question, right? It's like if you don't know, before you decide or talk on it, you have to learn a little bit more. Because I think that most of these issues come in that we are kind of like sheep. We
Is
blindly
Google a safe place, or
uh
WebMD, or
I mean, I think it's a combination of looking at multiple sources and having conversation about it, right? I mean,
absolutely
I think you can, I could find anything I wanted to on the internet. I could find some place to support whatever insane opinion I had. But I think just being more educated about it or having the conversation or doing your own research is the part that we don't do. We are sheep. We kind of follow each other. You hear someone else complain about it, and half the people I talk to complain about our system, but because they heard someone else say it, they don't really
right.
have any idea how it works,
It was
right?
on the news.
Or right, or and if you're watching, it's like birds of a feather, right? Like people who are like-minded are going to be where you get your source, and just be open to and make your own decision. That is my advice, is that
I
when
agree.
you don't know, it's okay. And you don't have to be the subject matter expert, but lean into it, because these things are important. And, especially for someone who's sitting, on my side of it. And I was never like anti marketplace, like a lot of brokers can be. I was not. I think there's a place for it. I think everybody should be covered, and I think preventative care is so important. And that's the unfortunate part for me, is that when people are not covered, the thing that falls to the wayside first is their preventative care,
Yeah.
right? And I had a cancer that was diagnosed because of annual like preventative care. Like,
Right.
so if there's anyone who can stand on a soapbox and say like, this is so important, I had no idea. Like, I'm not sick. I didn't have anything that would indicate that something was wrong besides this preventative check. So like,
Right.
one, you have to be covered. Two, you have to be educated. You don't have to be the expert, but you got to like lean into the uncomfortable. And before you have an opinion, or before you adopt someone else's opinion, you got to do some research, and you want to know about this stuff because it is important in your life, whether you realize it or not.
And just to add to everything you just said, because you stole all the things that I was thinking for
I mean,
sure.
great
Right?
minds think alike, buddy. Great
I mean,
minds.
it's like average minds are all going to think those same things, though. I mean, it's pretty
You
common
need to
sense.
quit putting us down. We know a thing or two.
No. It's common sense, but it's just not that common. Like if somebody took the time to think about it, they would. That's probably the answers they would land with. So I'm not discrediting us at all. But what I will say is, taking a little bit more control over your healthcare, right? I just remember, you know, like after you do your research, right? So do some research, or better yet, let your research be done with your provider. Like, ask questions. So what are the side effects of this, and what's the good, what's the bad? Are there alternatives? Is there, how long have you been prescribed this medication, or what is there a holistic treatment that I could try first, or these questions that, like, if I'm having some work done at my house, or having some work done on my car, or in any other service type of world, I'm gonna be like, well, wait, I mean, do we have to replace the whole thing, or is there a way to fix it? Like, do I need a new AC system, or can we just put a new compressor in there? Is that going to be cheaper or better, or like,
Be
or
your own
maybe,
advocate.
whatever, right? So
Yeah.
yes, ask questions, and don't just everything. That the doctor is still a human and still valuable, and still leans one way or the other as far as opinions on certain things. And so make sure that you're asking those questions, and you are giving a little pushback when and where necessary. I think back to, and this is the only experience that I have actually like kind of witnessed or had, or so it could be a little biased, but like I remember in the hospital, us, the second child, after we did our research, because the first child, we're just like, holy shit, we just had a kid. Like, we're just so,
Deer
holy,
in the headlights.
right? And they're like, you can't leave the hospital, and like, here's this jab in the leg, and this is a vaccination, and you don't know what's going on. It's just like bam, 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 like everything's happening, and you're just like, okay, these are doctors, nurses, this is a hospital, this is where people are taken care of. Like, I trust these people blindly, right? It's just kind of crazy. It's the only world that we do that in. So then we had a second baby, and we were like, no vaccinations, like no shots in the hospital. We're good. Like, baby just went through enough. Like, we're not giving these additional vaccinations. And again, I'm not saying like I've done all the research on this, but my wife has, and ran it all by me. And we're like, hey, I agree with you. Like, I back you 100% that, it's probably best we do things this way or that way. And we got the important stuff done. But the pushback that we got, like, you're not going to do vaccinations. Like, what? And it's like, hey, we're going to leave a day, or like, I know that you want us to stay like another day, but like, we're ready to go. Like, this is our second baby. Like, we know the deal. Baby's healthy. Everything's good. Unless you can tell me why I should stay one more night, and like, give me a real example. Like, we're going to go ahead and head out. Right. And they're like, are you sure you're gonna have to sign it? And we're like, yeah, we're leaving. We're going home with our baby, and we're not getting vaccinated. And like, this is what we're doing. And like, they look at you like the craziest person ever. And then you go into the doctor's office, and the doctor's office is like, okay, so I see you didn't do the vaccination. So, we can see you today, but you do understand that after 1 year, if your child's not vaccinated, we're not going to see him at this practice, just liability and whatever. Yeah, I don't know. Right. And we're like, okay, really? So like, now we got to go get a new doctor, right? We got to get a new provider because we're not doing the vaccinations. And then you feel like shunned. You're like, dang, dude, am I like being negligent? Like, the system is just that, right? It's a system, and it really does kind of, have this like, you know, control over the mindset where you're like, hey man, these are doctors, and these are like, healthcare practitioners, and they're not gonna, they want what's best for me and my child, and they know what's right and what's wrong. And while that is true in so many cases, why does one doctor say this X and another doctor says Y, right? These are two conflicting pieces of information from two doctors that even sometimes went to the same school and graduated the same degree, that have a difference of opinion on something. So that just shows you that there may be, some truth over here, some truth over here, and maybe the truth lies in the middle or whatnot, but
They
taking
tell
control
you
of your own
always
situations.
get a second opinion. That's the one of the first. I mean, we're sheep. I think that goes back to the same, like, we're sheep. Like, we're We're trained not to ever question the
Stop
doctor.
putting us down, Lori. Jeez.
I mean, we as a culture, we as a
It's true,
society are
right?
sheep, right? And so, yeah, I think that's, yeah, I mean, I feel it. I get it. We have aligned thinking on a lot of this. I'm not surprised, but I thought we would differ more actually than we did.
Oh
But
man.
well, so I know you got to go pick up kids and all of that good stuff. So one last question for you, totally off subject, but like, and it can be about this or it doesn't have to be, but like, if you had one piece of advice to give to your younger self that could potentially change it all. So if you knew then what you know now, like what would that piece of advice be?
You know what? You had even warned me that this was going to be a question that we wrap
Yeah.
up with, and I put like a split second of thought into it, and then it left my mind, like sometimes happens, and so I didn't really. So it is still on the spot, and what I would say to my younger self is, put your head down, run faster, run harder, and don't worry what anybody has to say or anybody thinks. Right? Like there was definitely years in my early teens, in my early adulthood, in my early entrepreneurship hood, if that's a thing, like like all of these, when you're newer, when you're just getting started, or when you're growing up, like you still, I did anyways, I won't speak for anyone else, but I definitely cared what people thought. And slowed me down, and so I would say, hey, do what you want to do, put your head down, run as fast as you can, and keep the blinders on. Don't worry what anybody else is doing around you. And, look up after a couple years and you're going to be blown away by where you're at, because that's kind of what I'm doing now. Which, it's taken some years for me to feel comfortable and say, what they're doing is amazing. And I'm so happy for what he's doing over there or what she's doing over here. But that's just not what I'm going to do. I'm going to do this, and we can all celebrate that together, right? It's not like one is right and one is wrong. It's just different. And so I think that goes back to what I was saying earlier about the open mind that I tend to have with things. And I would just encourage me not to care so much what other people think.
That's beautiful. And what great advice from the healthcare hustler. I mean,
The
really,
healthcare
right?
hustler. That's a good example of me not giving a shit what people think, because I did the whole Brad the broker. My wife made a joke the other day because she's like, I think it came up on her Instagram or something. I had a whole like, I went with the Bob the Builder theme, but I went with Brad the broker, and it was like construction. It was like helping you build your book of business, and
Oh
like,
my
and it was
goodness.
like construction, and like I've never been like, one of my agents described it as like, she was describing somebody else, but she's like, yeah, like he's great. He's like, he doesn't fear saying the things that leaders should say, like those cheesy, corny things that leaders say. And I'm like, wait a second. Like, do I say those cheesy, corny things? She's like, of course, you're a leader. Like, you're our boss. Like, you say the most cheesy, corny things. And I'm like what? And like she gives an example. I'm like, that's not cheesy and corny. That's like real. Like Zig Ziglar says, if you want to achieve, the level of success that you want to achieve, then you start helping others achieve that first, right? Like, in order for you to get everything you want, help others get what they
What
want.
they want.
And they say
Right.
that, and that's cheesy, corny. Like, so I've just never been afraid to, well, I say that. I I got to a point where I stopped being afraid of what people think, and it benefited me greatly. But it took a long time.
Hey, it took cancer for me to really not give a shit what anybody thought anymore. Like you just don't have time for it. So
Yeah,
to your younger self, tell him that like you just waste so much time worried about what everyone else thinks and that this feels better. I'm sure you feel that it feels better. It's exhausting to
for sure.
constantly look around at what everybody else is doing. So
Well, and let me just say, the fact that you're bringing that up on the podcast, and hopefully you continue to, because I think your story will inspire so many, because of your strength and who you are. It's funny to hear you say you didn't, you definitely don't give a shit what people think now, because I don't think you give a shit what people think before, but
I'm
now
nicer about it now. I'm
that's good.
like
That's good.
nicer and I really don't. And a lot of that was show, right? It was like you say, and you probably did this too. You say you don't care, but it's because you're flexing. You really do care
Right.
too much.
Right.
Now I really, really couldn't give a shit less because there's just no time for it. So
You can bleep it out if it's a problem, but fuck cancer, and you're going to beat the shit out of that cancer. So you're already well on your way. It's pretty impressive to see you. I know that you just started treatments and things, and you're still glowing. So you're rocking it, and I know it's not going to slow you down too much. Just like you said about me, nothing's going to slow me down. But truly, you're the same way, and that's why we get along well. So
I
thanks for having
appreciate
me on.
that. And I appreciate you. And thank you so much. And pick up your kids and switch on them for me. And I appreciate you. And we'll talk soon. And everybody do all the things so you get these updates and you can learn more from the Healthcare Hustler and go listen to Sarasota Speaks because he also has a podcast.
Subscribe.
He drops some knowledge. So I appreciate you, friend.
Thank you. Thanks for having me on.
Talk
Make it
soon.
make sense.
Bye.
Bye.